Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. I hope you've been enjoying our Facebook sessions where we have been trying to give you factual information straight from our experts so that you can be absolutely sure to get authentic information about your health and be fine-tuned towards your health and well-being as well. Breastfeeding a baby is an overwhelming and emotional experience for new mothers, and we know that the act of breastfeeding holds equal importance to both the mother and baby. Not only does it help in the all-round development of the newborn baby, but it also helps new mothers in numerous ways, also to connect with their babies. World Breastfeeding Week is celebrated from 1st to 7th August every year. In this week, we aim to spread awareness about the importance of breastfeeding. And this is actually marked and celebrated in more than 120 countries in the world. This year's focus is on strengthening the capacity of those who need to protect, promote, and support breastfeeding across different levels of society. So that could actually make up what they call the warm chain of support for breastfeeding. And the target audiences to increase awareness include even governments, health systems, workplaces, communities, that will all need to be informed, educated, and empowered to strengthen their capacity to provide and sustain breastfeeding friendly environments for families, especially in the post-pandemic world. One important aspect which is critical in promoting breastfeeding is awareness. And one of the main pillars in this campaign is also creating information, dispelling myths and misconceptions, and improving that awareness about breastfeeding. So today we have this very special session on breastfeeding, its benefits, and also about the many myths and misconceptions that often surround it. To share her insights, I'm delighted to welcome Dr. Meena Tyagarajan, who is Senior Consultant Pediatrician, Neonatologist at Apollo Hospitals, Chennai. Having completed her MBBS from the Madras Medical College, she has been trained in pediatrics in the United Kingdom, holding a diploma in child health from the Royal College of Pediatrics and Child Health in UK, MRCP as well, in 1997. She has over 31 years of experience, is a very well-known pediatrician and neonatologist, and has also been in the Apollo hospitals for over the last 19 years. She also holds membership of the Tamil Nadu Medical Council, the Indian Neonatology Forum, the Indian Medical Association, and the General Medical Council UK. She advocates preventive care, which focuses on taking adequate steps to prevent childhood ailments rather than treating them after they happen. Hello, Dr. Meena, and welcome to this Facebook session where we would like your insights and your advice on breastfeeding, and we'll also talk a little bit about the benefits and some of the common frequently asked questions that new mothers often have, and then we'll come to some of the common myths and misconceptions.
Thank you for having me over, Srinidhi. It's an honor to be talking to new mothers or mothers-to-be about breastfeeding, which is something which is very close to my heart. I'm just going to let you shoot off your questions so that, we can make a start, and then if there are any other things coming up, I can answer them.
So we could begin by general benefits of breastfeeding. In fact, some of these questions have been from what people have been searching for, so we have put them all together. So we can begin by just talking about why should a new mother actually focus on breastfeeding as opposed to other types of feeding her newborn?
See, as it's always been said, nothing close to breast milk in this world. A baby, whether it is born to a cow, a goat, a calf, whether it's a human being or even in the wild, the mother's own milk is the best milk. It's supposed to be, next to nothing to match it. So I think, I mean, we don't need to give explanations about why goes to have a baby, that breast milk is the only choice they have. India is a country which has umpteen, under 5 deaths. It can be reduced, and these under 5 deaths are because of lack of breastfeeding in the early days, early weeks, and first 6 months of life. You can reduce the number of respiratory infections, GI infections. So I think people should understand that there's nothing next to breast milk. And we do have alternatives, but that is only secondary. I mean, there's so many advantages. It is completely conducive for the baby, the right temperature, it comes free of cost, it has all the necessary carbohydrates, proteins, and fat and vitamins, minerals. And it is something which is easily available. And there's 99% of my mothers breastfeed. And I think there's a very small percentage that's unable to do for various reasons. And then we always have an alternative. But nevertheless, I think breastfeeding is the best thing that can happen to any newborn.
So, is it something which is instinctive to the actual act of breastfeeding? Does it, when a mother delivers, is there something that the as a healthcare provider or the obstetrician should as part of the antenatal and the other checks? So, should there be any kind of guidance given to a new mother, or is it instinctive and just comes naturally?
Right.
There be
The
any information given as soon as the birth happens?
right. The thing is that, I mean, these days, most deliveries, at least in the larger cities and towns, are all, mothers do get to see a gynecologist very early on. So the first person that they touch base with is the obstetrician and gynecologist. So starting from there, the idea of breastfeeding should be actually, impregnated into the mother's head. And the family needs to be aware that they should also be, on the same page as the healthcare providers. So we do think that, attending antenatal classes from the second trimester onwards, where there is a talk about, labor and what they can anticipate and foresee, and breastfeeding should be commenced as early as the second trimester. It should be available to all mothers, whether it's in the private sector or the public sector, so that everybody is aware, their mindset is such that they know that this is the only choice they literally have. So I think it would be nice if you could, we could also talk to extended family so that, they're also educated in everything that's going to be giving birth to in the next few months.
And when should breastfeeding begin after delivery?
Within the first half an hour, if possible, or
Mhm.
the 59th minute. Within the 59th minute, I never say the first 1 hour. I mention it in minutes, and I tell my nurses, and all of us are very particular that we try and get the baby to be fed within the hour when sucking is most active. The baby is just has an appetite as soon as it's born, and he or she needs, the sucking reflex is so strong that we need to put the baby on almost immediately.
There is often among first mothers, there is this fear that, because they might have heard about instances of mastitis and so on, and where they have pain. So there is a fear if breastfeeding is a painful thing. Is it painful?
Not at all if we have actually primed the mother with what she should do. I mean, the way I approach a newborn a mother who's just birthed a baby is to, we all talk about breastfeeding, but the most important word that I use is latching, appropriate latching. If the mother from the birth, from her first very act of feeding her newborn, actually latches her baby effectively, then the question of painful breasts and painful nipples doesn't arise. It's very easily said than done. So all the healthcare providers who surround the mother, whether it is the OBG, whether it's the neonatologist, the junior doctors, the nurses, or even the housekeeping staff, I think everybody should be made aware that if you're asked a question, we should be on the same page, which is appropriate latching to ensure that they don't get painful nipples and breasts.
But are there any situations where there could be some physical problems in breastfeeding, or even some situations where it is, what are they? Because we have heard that even in COVID times, we were encouraging that the mothers should breastfeed.
Right. I don't think there are really serious contraindications except for maybe a mother who has to get onto chemotherapy or maybe has active, tuberculosis. Even that, if they're appropriately, if they've been medicated for a week or so, they should be all right to feed. And even COVID, severe COVID, unless a mother is indisposed herself, she is sick, she is in ICU, is in the ICU, or she is unwell with something where she cannot lift herself to even feed her baby, then it may be a bit difficult to get the baby to feed directly. But there are instances where we can express milk in a different place and give it to the baby.
So, coming to this expressing milk and storing it, this is often something that happens once the mother is back at home and then may need to go to work and things like that. So, could you tell us a little bit about how this should be done and how should this breast milk be stored and fed?
Breast milk expression has to be done very carefully because
Yeah.
you don't, putting the baby directly on the breast is one thing, but then by expressing the milk, the whole process has to be in a very clean it should be a very clean process where the mother will have to sit down in a room which is uninterrupted, and she has to wash her hands, wash the entire equipment that she's going to use, whether it's a manual pump or an electric pump. She'll have to ensure that it is washed adequately with soap and water, and it's dried and then used with clean hands. She has to express the milk into a container which is again sterilized and store it away in the fridge for at least 4 to 6 to 8 hours. It can be stored in the fridge, and if it is in the freezer, then it can be for as long as a few months. Actually, it can be stored. But storing, more than storing, it is breast milk is, it's an ingredient, it has ingredients which can get spoiled. So if it is stored either in the fridge or freezer, there are ways to adequately thaw them and use them. So that's something that people can read up about or can be told when they do these things.
But it is still always better to express the
Of
milk and
course.
store it rather than go in for artificial formulas.
Right, especially when they get to work. I
Yeah.
think mothers who have a good supply, most of the mothers that I see, they do express milk, leave it behind for the caregivers to give it to the babies. And they also express milk at work. And there are these days facilities at work where they can store milk in the freezer or keep it in a ice bag and bring it back home. So things are available these days, unlike days when we had our children. So much easier now.
And how frequently should a baby be fed? Because there is always this theory that it should be on demand, or it should be like by the clock. So, what is your advice?
It should be, it's a bit of both, right? So I think in the initial period, when the first 2 3 days, it's only colostrum, which is very little milk, it's thin, it doesn't satisfy the baby maybe, but it will be sufficient to sustain the baby. So the baby will want to keep latching on and feeding. So there are babies that feed almost every hour to 2 hourly, but there is no ballpark figure. I mean, I say approximately every 2 hours, initial few days to weeks, so that we get the letdown happening. Initially, the milk that comes out is the colostrum, which is highly nutritious. It has all the antibodies. That should be, the baby should get the benefit of that as much as possible. And then the transitional milk, which happens for a few days, and letdown almost takes 2 to 3 weeks when you get a good supply. And there's always a question in Srinidhi, which I want people to, because people cannot quantify breast milk if you're not expressing it. So there's always this question, how do I know my baby is getting enough? I don't know if you had this question posed for me later, but I want to let them know that the baby's satisfaction, baby's number of pee nappies that they have, urine nappies, and poop changing color, and the baby gaining weight is the only way you can tell that your milk is sufficient or not.
And I think it's also true, isn't it, that the more you do it, the more the milk flow will start. I mean, there's always this. Some people feel that, oh, I'm not getting, so let's top it up. So I think it's important to keep trying.
That's right.
Yeah,
And nothing like the active suck of the baby's mouth. Even
yeah,
your machine, which is going to express your manual pump or your electric pump, is not as good as the, because with the baby there's five senses which is met with, that your pump cannot do that, right?
yeah.
So your baby has, you have an emotional bonding when you put the baby on the breast, and nothing like that. So I think automatically your brain just lets down the milk, and I think that has much more effect than using a pump.
Right. I think now we'll come to the actual topic of today, which is really all these myths and misconceptions, which seem to abound, even today for delivery and, these kind of things, breastfeeding, neonatal care. There are a lot of uh, myths, or there might be, like native uh, family traditions and so many other things, beliefs, superstitions, a lot of things. So we've collected a few of them, and of course, do feel free to add more. But
Sure.
there's often the story that the first milk, which we actually know is so valuable, is not to be given to children. Now, I don't know, this is just a collection of different beliefs. I don't know where, like, may not be all in one particular region of the country or something, but this is one of the myths. So, I mean, what would you like to say to that?
As I said to you earlier, colostrum, or in Tamil they say is the most important milk. It's so beneficial to the baby. No way somebody should express it and discard it. It does look a little yellowy, and there's just drops coming out of the breast, and it is the ultimate liquid gold that comes out of the breast. There's no way we should discard it. If it is happening in parts of the world or parts of India, it may be people who have not been educated about it. So we shouldn't, we should be dispelling those myths and say that no, the first 3 days is very important. Even when we have babies in the NICU on the ventilator, I always say the first 3 days milk will never come back till your next pregnancy. So we should express it, and even just rub it on the baby's tongue and lips, so that the baby is primed with the mother's colostrum first before we do anything.
Another common thing is to feed the baby sugar water or honey before the feed, or instead of the feed. So, what are the harmful effects of this?
That's a big no from me,
Yeah.
because sugar is something that I completely, I abhor, and I tell parents that they cannot give their babies sugar even up until the toddler age group. Only after one they even see the signs of sugar in there. Other natural sugars which exist in food is fine, but no added sugar. So sugar water is a big no, and honey is out of question. There are issues, things have happened with conditions called botulism, which can affect the nervous system when honey is given to babies. So there's nothing like that. In those days, I think many, many decades ago, sugar water was the first thing that they would give. If we are lacking, milk due to certain reasons, then, we have to go to the alternative availability, not sugar water or honey.
A lot of mothers also think that they should not breastfeed if they have certain infections, or if they're, even with a cold or a mild fever. So, what conditions? I mean, you already said that unless the mother is very sick, we still
Correct.
continue, but would you like to say a little more about that?
See, COVID, for example, it was the worst of its kind. People, we were not sure whether the mother could breastfeed, but then we came to realize that the advantages of breastfeeding with even with the mother having COVID was ultimate. So we just told them to practice things like breast hygiene, hand hygiene, and respiratory hygiene. So wear an N95 mask, clean your hands with soap water, use some alcohol, rubs, and then clean your breast properly and feed your baby. So if we allowed mothers, or rather, we pushed for mothers to feed even during COVID, then I think even a mild temperature, fever, upper respiratory infection shouldn't be a no-no, for a mother to feed. Then mothers ask us these questions. I'm taking paracetamol, doctor. Am I allowed an antibiotic? And we tell them that when your child is sick, even a newborn, preterm baby, as young as 24, 25 weeks, gets an antibiotic if it needs. So if you're taking an antibiotic, just make sure you tell your physician or your OGSHIN that you are breastfeeding your baby, and that is it okay to take these particular medications, or they ask us. So most infections you can, even if somebody has a breast abscess, and maybe you might, if unless they're having an infection which is open infection, I think it's absolutely fine to feed your baby if you're on antibiotics.
That was, in fact, the next question. But I
Yeah,
think, as
sorry.
you said, regarding the medications, I think it's best then to ask the doctor, because people take all sorts of medications apart from even antibiotics. But as you said, it's best to check with your doctor
Physician.
whether that's all right. Yeah. Another question which people often have is: do the newborns also need to be fed water along with the milk? Is it necessary for them, or is the milk sufficient?
The foremilk which comes out of the breast, which is thin and watery, that has protein and carbohydrate, that will quench the baby's thirst.
Yeah.
And the milk which comes on later, the hind milk, which is thick and has fat, that will satiate its appetite. So how can there be anything given
Oh,
extra? There's no need for any extra water, even if you're living in the desert of, in the Saudi Arabian desert or wherever. So I think even in the hottest of places, you don't need to give extra water at all.
another question is about exercise and the quantity and quality of breast milk. Is there any connection at all?
Exercise, post exercise, because there's a release of lactic acid, can make the milk a bit bitter.
Yeah.
But if the mother doesn't do very rigorous exercising, and try to get on this weight, wanting to lose weight kind of situation, she can have a shower and she can breastfeed her baby. But rigorous exercising, like, getting on the treadmill like a few months after, I think a gentle exercising, yoga, postnatal yoga, and maybe walking is absolutely fine. That shouldn't do much to your reduction in breast milk supply.
Also, does breastfeeding cause weight loss? Does it help the mother to lose her pregnancy weight?
Of course, it does. I mean, that's a well-known fact that
Yeah.
breastfeeding does help with some amount of weight loss. But it also, I think people automatically, when you tell them that you will lose some amount of weight, tend to breastfeed more rigorously. So it's something that we see many mothers doing because they know that they will have some amount of weight loss post um, post lactation, for a year or two.
Is it true that a mother who has undergone a cesarean section will not be able to immediately produce milk, unlike another who has undergone a normal delivery?
That's not true. But the only thing is that the mother who's undergone a cesarean section tends to lie flat and has all these tubes coming out, and they start drinking or eating only after almost 24 hours. But milk supply is happening. You even tend to produce milk even before delivery. So the baby is going to get the benefit of colostrum, whether it's a normal delivery, instrumental delivery, or cesarean section. It doesn't matter. Um, But a mother who has a normal delivery or an instrumental delivery has more chance of drinking and eating straight away. So they think that, yes, the production is a little better, but that's not true. I think mothers tend have to put them within the hour, even in a C-section, so that the supply gets kickstarted.
Um, Another question is about what a breastfeeding mother should eat and drink. So
Mm.
there are many myths that abound there because there is on one hand a lot of foods which people believe would increase milk production. For example, a lot of people give things like milk and garlic and things like that. But there's also this other myth that they should not eat certain things and they should eat only bland food. So what is it? What's the scientific truth behind these?
See, I think, I always tell people that, we should eat a normal, balanced diet and drink enough water to keep yourself hydrated. This whole thing about patya sapadu, which is what is said to us, I'm like, if somebody at home insists that you don't eat this and eat that, well, they are all eating those kind of foods, then tell them the entire family has to eat patya sapadu. It's not just for the
That
poor mother.
that thing will end immediately, I'm sure.
I'm sure.
Yeah.
So they can eat. There are lots of natural lactagogues which produce milk, help you produce milk, like fenugreek, vendium, garlic, and oatmeal, lots of green vegetables, almonds, fish, eggs. Nothing too spicy or too much of tamarind in their diet. Sometimes things can alter the taste of milk. I think they can just have a balanced meal with lots of fluid intake. So if cows can just graze on grass and produce milk, we humans should do well, right? In eating just a balanced, nutritious meal with water as well.
Um, Also, does the lactating mother, I mean, depending on the size of her breast, the milk production would vary is another question that people are worried about. So is that true?
Not true at all. The larger the breast doesn't mean that you're going to produce more milk, and the smaller the breast, it's immaterial. Whether it's a small size breast or large size breast, if you're doing justice to it, you're latching your baby well, you're sipping water, you're sitting in a room. I'd like to mention how they'd like to do that. I think one, it should be an uninterrupted procedure, or a what happens is we tend to have people walking in and out of the room when a new mother is breastfeeding. I think there should be no, it should be a quiet, cool environment. The mother should have had a shower. She should be sitting there. I always say, with your hair tied up so you're not hot and sweaty, in a room which has a comfortable temperature. She shouldn't be sweating away and bending backwards. Should sit in a chair with a backrest or on the bed where she's comfortable, maybe have a soft pillow, and put her phone away. That's my new addition to all my
Oh,
lectures on breast milk. This phone is the biggest distraction. I think the phone should be kept far away, and they could probably listen to some music. Turn away from the door, because when somebody suddenly opens the door, I realize the
um,
mother also, she's just distracted. So it should be like a gentle atmosphere so she is comfortable to feed the baby, in a very nice environment.
right.
Did I answer your question, Srinidhi?
Yes, of course.
Okay.
But I just want to finish with expanding this a little further. So, especially as the theme this year for World Breastfeeding Week is really about creating this conducive environment, not just at
Mhm.
home, but at other spaces, at work. So, do you have anything to suggest on what offices, workplaces, which is the next frequent place where mothers are likely to be? So you already said about expressing milk, but also about if a baby is also with the mother. So, public places, places where. So, what kind of facilities and what do you think should be done at a community level or at the government level to make it a little more easier on the woman to breastfeed her baby?
See, I think Indians, basically, we are very shy of talking about breastfeeding. We're very shy of actually breastfeeding in public,
Mm.
because it's just our nature. It's just second to us.
Mm.
And when you go abroad, you don't see mothers really worrying. You even see mothers carrying their babies, and I've seen people breastfeeding in public places. But that will not happen in our country. We need that little privacy. So I think, see, hospitals cater to it. We do have breastfeeding rooms. But workplaces, if you have like a creche attached to your workplace, I'm sure there is provision for breastfeeding. But places like the airport or the station, railway station, or a bus terminus, um, even the hotels. I mean, I remember years ago sitting in a hotel, had to go to the restroom, which had at least a chair. I sat actually on the counter, the wash basin counter, and breastfed my child because that was my way of looking at giving. But those days, we didn't have enough places to be sitting down in privacy and feeding our babies. So I think that is very important to have it everywhere. We should have this little space with privacy to be able to, breastfeed our babies wherever we are. We shouldn't be held back at home because we can't, go to have a meal outside, or we can't travel in the flight. I've told parents, when you're taking off, please, you will have to, breastfeed your baby on takeoff and landing. You don't have anybody peering over your neck, even looking at you. So it's quite simple to do that when you take off and land, but it should be available everywhere. We should make it a universal thing where we have some privacy. And that is the only way we are going to push for all mothers to breastfeed exclusively for the first 6 months, and subsequently up to 1 year, maybe 1.5, 2 years, if luck is on our side.
Thank you so much, Dr. Meena, for this
My
wonderful
pleasure.
discussion. I think you've taken all our questions and also given this much needed information as well as motivation for our new mothers and mothers to be to breastfeed. And I also hope that the theme for this year's World Breastfeeding Week is very important for the community to create that conducive environment so that mothers can optimally breastfeed. And I do hope that everybody in our system will be part of this warm chain, helping to step up breastfeeding and make a real difference to the health of our nation. Thank you and namaste.
Thank you very much.